18 minutes now before the 11 o'clock hour. Military families face a number of challenges when asked to relocate, and one of them is finding employment for the spouse of that active duty member of the military. Now, Inova Health System has signed on as a member of the Army Spouse Employment Partnership. It's designed to create jobs for the nation's estimated 680,000 military spouses. Daniel Nichols is Executive Director of Military to Medicine, and he's live this morning in the studio. Great to have you here.
Thank you.
This is a terrific idea, it seems to me. You have a large number of talented, organized, motivated, disciplined, potential employees out there that up until this point haven't really been courted all that actively by the private sector.
We call that the military talent that's really been underutilized, underappreciated in the workforce by employers. For us at Inova, we figured out fairly early on the past several years that one of the top reasons for transition of people out of Inova was due to this military transition. And when I was speaking to managers across the organization, the question I asked, about military spouses, knowing that there is this transition that takes place, but every single one across the board said, you know what, they hit the ground running. They work hard from the time they come in to the time they leave, and if we can only have them for a year, or for 2 years, or for 3 years, we'll take one. And so that spurred us along to this.
So Inova joins a number of the American Health Services Association of Military Banks of America, Jackson Hewitt, National Military Family Association, and Walmart as organizations that have gotten involved in this. The kinds of jobs that you can place these military spouses in, is it varied? Do they represent sort of the spectrum of skill sets, to use that employment term?
Absolutely. And honestly, what the spouse is looking for is portability. So can they get into a job, into a career in one point in their life, and as they move and transition, can they keep that career? And so healthcare is actually one of the top choices, healthcare, real estate, and education. The military spouses choose, so it's a real natural fit for us.
We're talking about all the positives, though. Are there downsides to this? Are there problems that need to be overcome?
Part of it, I think, the change in how people work in their career lives in general. I'd say it used to be more of an issue to have a 3-year, 4-year career in a company. Now that's almost a full career in terms of you look at people changing jobs. So I think a lot of that has been answered.
The stars have aligned, it seems like, in a lot of ways here. There is this availability. There are needs on the part of employers, and the question is just getting them hooked up. How do you do that? How do you find the right people for the jobs?
Well, it is about a ready workforce. And then that's what we're trying to help these military spouses, military talent pool come to. And you're right, there are some gaps because of this transition, especially in healthcare with certification requirements. They may not have all of the training that they need, lacked some, they may have been out of that job for a little while. And so we provide healthcare training and then also assistance in placement to keep them. It's really about recruitment and retention here, but also on a national level.
If we have piqued some interest in this, go to Inova.org for more information. Daniel Nichols is Executive Director of Military to Medicine for Inova. Thanks so much for joining us.
Thank you.
Great program in which you are involved.